Hello, I'm Dr. Robert LaBelle. Today we're going to be talking about mechanical neck pain or neck pain and the associated disorders such as whiplash and headache. Neck pain is a common condition we see in clinical practice every day. A lot of people will experience neck pain in their life, and invariably we will all experience it at some point. Hopefully it won't be a chronic condition. Neck pain typically can reside in one of two places, up in the upper cervical spine or down in the top of the shoulder blades. Different muscles become affected in neck pain, and a lot of the same muscles are affected always. The levator scapulae muscle very often becomes tight, and the upper trapezius becomes tight. As these two tissues become tight, very often it ends up pulling the patient into what we call an upper cross syndrome. And what that is where the shoulders will drop, and then the patient will bring their head up to meet the horizontal plane. And you can clearly see that the distance between here and here shortens, and then this tissue becomes stiff, it develops trigger points and becomes fibrotic. This very often will affect people who sit all day long, whether they're working on their computer, and it can just happen to a lot of people who just have poor sitting posture. So when you get home at night and you sit on a couch and the couch just has poor support, it's very important to assess. So the first treatment with any patient with these sort of mechanical neck pain disorders is to really assess their posture from the bottom up and get them to elevate up and educate them. This immediately will help to stretch out these tissues, preventing future overload of these tissues. Treatment at CCSR in office is aimed at releasing these tissues. We release these tissues with active release, Graston technique, and different types of stretching. As well, we typically show the patient a home program of ball work where we take a small tennis ball sized ball where we have them release these against the wall and teaching them different stretches to help manage the stiffness as it starts to set in throughout the day. Different conditions in the neck can basically affect the head, and one of the biggest ones that I see is headaches. Headaches, there's different types. There's tension headaches and there's migraines. Typically they fall in two classifications. A tension headache can come from tight muscles and tight joints in the neck, and migraines are typically have a chemical origin, whether different hormonal changes as well as different pressure or atmospheric pressure changes in the month. When we're dealing with mechanical headaches, which is something I deal a lot with, there's two major muscle groups that really cause pain. The upper trapezius that starts from here and travels up into the head here develops quite a bit of knots here. And when they develop the knots here, the referred pain will travel up into the temple. And that pain typically comes on near the end of the day. You've been working all day, you've started to slowly slouch because of gravity, you bring this head up because you're doing computer work, this tissue tensions, and then the referred pain comes and you're felt as a headache. The second area that typically becomes affected is the suboccipital muscles. They're up at the base of the skull, deep into here, and they go along the rim of the occiput or the rim of the skull in the back there. Those headaches are typically felt shooting through the head, the referred pain shooting through the head to the same side behind the eye, sometimes causing the patient to squint or have what would be considered eye strain. The other condition that we see a lot associated with neck pain is whiplashes as a result of motor vehicle accidents or falls. Whiplashes tend to affect the same muscles, they just affect it a little bit more acutely or vigorously. During a car accident, force is transferred so quickly that these muscles end up whipping in nature, and you end up potentially causing micro tears to the tissue. Those micro tears are felt as pretty intense neck pain. And so the treatment at CCSR is aimed at reducing the acute inflammation through icing, laser, and rest, and then slowly rebuilding the tissue with different muscular techniques such as active release and Graston. If the joints are quite injured, manipulation and mobilization of the joints becomes warranted as well. through all these neck conditions, a very vigorous home rehab program will be initiated with the patient to help manage their neck when they're outside of the office.